My name is Mike. I am 66 years old and we are in the town of Rhodhiss, North Carolina. Year before last, the week before Christmas, it was a Saturday night. I had not felt good for a day or so. I went to the emergency room. The doctor came in and said, "We got to get you to Fry Heart Center as soon as possible. You're in the middle of a massive heart attack." I was in the hospital, I think 10 days total, 9 of it in critical care. And that's when they released me to cardiologist. And when I was there at the doctor's office, that's when I was introduced to Cadence. They sent me home with a set of scales and with the blood pressure equipment. It had built-in cell phone technology that sent the readings immediately to Cadence. And I'd been taking that every day anyway, and just kept it for when I would go to the doctor. So it wasn't no more out of the way for me. As a matter of fact, it was less work for me. The technology is no problem. I think all you would really need is a cell phone. And even a person with limited knowledge about it, they put the app on for me and everything else the day I was in there. And, it really don't need any maintenance after that, or, it should be easy for anyone. Thanks to Cadence, I think one of the biggest things that they have done is help me get my medication regulated. If a reading gets out of whack or something like that, I get a text or a call. I have a call from a nurse every week going over my readings. My medications are regulated. My blood pressure is where they want it to be, and it's just been terrific.
LifePoint Health's mission is making communities healthier. That does not mean just when they're in the hospital or just when they're in our clinics. It is a 24/7, 365, how do we make our communities healthier? And we're really excited about what Cadence is doing in the markets that we're deployed already. What's even more impressive is once we've rolled Cadence out across our enterprise, we see at least 100,000 patients that will have this technology and these support services helping them stay healthy each and every day so that they don't have to be in the emergency department or in the hospital away from family, but that their chronic disease is managed more effectively so that they can be at home or doing the things that they love in the community.
Thanks to Cadence and the doctors, my mental health has improved. I think a lot of it because my physical health has improved tremendously, and I'm actually starting to feel back normal again. We have started trying to go to the beach once a month. So earlier in the year and even before, I had a hard time even walking to the beach or whatever, 100 yards, I couldn't do it. As far as my wife, Cadence has lifted a load off of her mind so she don't have to worry like what she did before. She probably worried more than I did, and I hate she had to go through that, but with Cadence and the doctor's help, that has took a load off of her mind. At this point in my life, I want to stay healthy, mainly for my family, for my wife. She's just a little bit younger than me, so I have to stay healthy to try to keep up with her. Kids, and got one grandchild, and I want to see him I would like to live to see him to adulthood. So that's at least another 10, 20 years, so I got to stay healthy. I love life, and I want to live life to the fullest, and I want to live as long as I can. My wife is retiring in 2 months, so we're hoping to do some of the enjoyable things in life that we put off till then because we didn't have the time.